All right, can you tell me your first and last name and your date of birth?
Rosa Atchison, 5/19/1954.
Do you know where you are?
Lithonia, Georgia.
Do you know what year it is?
2020.
So patient's alert ordered times 4. All right, if she had any issues with smelling, I would test cranial nerve 1 for her smell, but she doesn't, so we won't test that. So looking at her head is normal cephalic. Her hair is evenly distributed. It's coarse. Her eyebrows are symmetrical. Her eyes are symmetrical. Her pupils are symmetrical. Her hair on her eyelashes and her eyebrows are evenly distributed. Her nose is midline with her facial features. Her lips are midline. They're pink and moist. There's no cracking or cyanosis. Her skin color is even and consistent with age, race, and ethnicity. Her skin on her face is dry, clean, and intact. It's even with the skin on her arms, her legs, and her feet. Can you uncross your legs? Her skin on different portions of her body, they're all even and consistent with age, race, and ethnicity. I don't see any cyanosis, no swelling, no rashes or redness on the arms, the face, the lips, her legs, her ankles, or her feet. All her skin looks even. All right, so now you are going to see me touch on you, okay? All right, so feeling the scalp, there's no indentations. Let me know if anything hurts. None tender on palpation. No nodules or bulges felt. Feeling the ears, the auricles. There is no nodules, no tenderness. No nodules or tenderness on the earlobes. The tragus, there's no redness, no nodules or tenderness. Mastoid process, does that hurt?
No.
All right, so bilateral, symmetrical mastoid process, no pain. Can you clench down for me? Can you move your chin side to side? Can you open your mouth? Okay, you can close your mouth. Does any of that hurt?
No.
All right, so no pain with TMJ assessment. All right, so now assessing my lymph nodes, pre-auricular, post-auricular, occipital, posterior cervical chain, deep cervical chain, superior cervical chain, jugulogastric, supraclavicular, submandibular, submental. Any of that hurt?
No.
No pain, inflammation, or enlargement or any of the lymph nodes. No more felt. Assessing the trachea. Trachea is midline. There's no deviation. Can you hold your head back and swallow for me? Swallow.
Excuse me.
It's okay. So swallowing shows that the thyroid rises and falls with swallowing. All right. Skin is warm to touch and dry. All right. So now I'm going to continue feeling. So lymph nodes, there's no enlargement. Feeling the frontal sinuses. Any pain?
No.
Okay. Maxillary sinuses. Any pain?
No.
So no enlargement, no tenderness or warmth felt on the frontal or maxillary sinuses. The eyes, the sclera is white. The conjunctiva is pink. Let me know if this hurt. Lacrimal apparatus, there's no drainage or no tenderness from the lacrimal apparatus. All right, I'm assessing your face, assessing your nose, non-tender. Can you blow out this nostril? Can you blow out that nostril? So nares are patent. Palpating the lips, the mouth, no tenderness noted on palpation of any of the facial features. All right, so now I am going to look into your eyes. All right. All right, so looking into, relax. Look into this eye. Pupil is a +2. Pupils are equal reactive to light and accommodate. Also noting direct light reflex in this eye with concentric light reflex in the other eye. This pupil is a +2. Pupils are equal round and reactive to light. It accommodates. Direct light reflex in that eye with concentric reflex in the other eye. Alright, so I'm going to look into your eyes. Just look forward for me, okay? Try to look straight. So I'm noting pupillary light reflexes symmetric in both of the pupils. So assessing her left eye first. Her cornea is clear. It's intact. The red reflex is bright red. It's also intact. I'm able to see the retinal vessels. I'm able to see the optic disc. It's a yellowish orange color. Her ocular fundus is a bright brown color. It's also intact. There's no cloudiness noted in the cornea as well. All right. This eye, I'm able to see the red reflex. It's a bright red color. It's intact. The ocular fundus is a bright brown color. It's also intact. The cornea is clear. There's no cloudiness. The optic disc is a yellowish orange color. It's also intact and round, and the retinal vessels are also visible. All right, so now I'm going to have you follow my finger with your eyes. I'm testing for cardinal gaze. Okay. So far, extraocular movements are good in both eyes. There's no nystagmus. And good accommodation is noted. All right, can you cover one eye? We're going to test for peripheral vision. Let me know when you see my fingers coming in.
All right.
Okay. Can you cover the other eye for me? Let me know when you see my fingers.
All right.
Okay, so peripheral vision is noted in both of the eyes. All right, I'm gonna also have you close your eyes again for me. All right, so touch each finger with your nose while your eyes are closed. Each finger, one at a time.
Like that.
Yes. Next hand. Okay, you can open your eyes. So coordination is noted with finger to nose touch. Close your eyes for me one more time. All right, let me see your hand. Let me know what I draw in your hand.
Uh-oh.
No, it's a number.
A 6.
Yes, so graphesio test is good. Noting that there's no cerebral dysfunction and sensation is good in the hands. All right, I'm gonna touch on different parts of your face. Let me know if it's hard or if it's soft, and let me know where.
My forehead is hard. On my nose, it's hard. On my chin is soft.
Okay, so cranial nerve 7 and 6 are also intact. Sensation is felt on the face. You can open your eyes now. All right, so now I'm going to assess your ears. All right, so feeling on your ears, there was no tenderness, no nodules felt, no redness or lesions. The external canal, there's no drainage or redness or scars noted in either ear. All right, so first I'm going to assess this left ear. All right, so looking in the ear. All right, so there the hair is evenly distributed. There's a little bit of cerumen. The tympanic membrane is a pearly gray color. The eardrum is intact and concave. It's not movable. The incus, malleus, and umbel are visible. They're intact. The cone of light is visible and bright. There's no scarring, redness, or lesions or drainage coming from the ear. All right, we're going to look into your other ear. All right, so there's no drainage coming out the external meatus. So looking inside the ear. There's hair is evenly distributed. Cerumen is noted in the ear. The ear canal is clear. There's no redness or drainage. The tympanic membrane is a pearly gray color. It's intact. Cone of light is bright. Eardrum is concave and intact and non-movable. Incus, malleus, and umbel are also noted. All right. So I'm going to whisper something in your ear, and I want you to say it out loud.
AT&T.
Okay, so testing a whisper test for hearing.
1, 2, 3.
Okay, so hearing is intact. So cranial nerve 8 acoustic is intact. All right. So now I'm going to look inside your nose. Can you jump how you hold your hair? Yeah. All right. So looking at her nares, the nasal mucosa is pink, it's moist, there's no scarring, redness, or lesions, there's no drainage, hair is evenly distributed, the inferior and median tubernates are intact, there's no swelling or redness, they're pink. The septum is midline, there's no deviation. Same on this side, hair is evenly distributed, no deviation of the septum, no drainage or redness or scars. Nares are intact and nasal passages are patent. All right. So now I'm going to look inside your mouth. So can you put your teeth down for me? All right, so teeth are evenly aligned. They're white. There are no missing teeth. You don't have to do it that hard. Cleanse your teeth. Open your mouth. All right, can you go like this with your gums? All right, so gums are pink. Veins are visible. Gums are moist. All right, you can stop. You can open your mouth for me. Stick your tongue out. Tongue is pink and moist. Can you move your tongue side to side? Can you move it up and down? All right, so tongue is midline, rises midline in the mouth. Movements are good. Open your mouth for me again. All right, so oral mucosa is pink and moist. There's no scars, redness, or lesions. Say ah.
Ah.
Uvula rises on phonation. The posterior pharynx is pink. She had a tonsillectomy, so there are no tonsils noted. All right, I'm going to assess your gag. All right, say ah.
Ah.
Okay, so gag reflex is intact. All right, so now I'm going to touch your tongue. So stick your tongue out for me again. All right. So good tongue strength. Noted. All right. Can you say light, tight, dynamite?
Light, tight, dynamite.
So cranial nerve 12 is also intact, as well as cranial nerve 1, 2, 3, 4, and 6, 7, and 8. All right. So now, looking at her chest rises and falls on inspiration. Her respirations are even. They're non-labored. They're easy. There's no retractions noted. No abdominal retractions noted. No accessory muscle use. Respirations are about 14. They're even and easy. All right, so now I'm going to percuss on your chest. You're going to put me tapping on your chest, okay? So tympani noted in the lung fields. Changing to dull when I leave the lung fields. Tympani noted on this side. Okay, so I want you to say 99 for me. Keep saying 99.
99.
Assessing for tactile
99.
fremitus.
99.
Vibrations
99.
are even on both sides. All right. So I'm going to listen to your part. All right. Say 99 for me again.
99.
Testing bronchophony.
99. 99. 99.
Whisper it. Okay. You can stop. So bronchophony test reveals sounds are muffled and not clearly heard. So that's good. Now I'm going to listen to your breath sounds. So assessing the tracheal breath sounds. Okay, so inspiration is less than expiration. It's high pitch, clear, no adventitious sounds. Feeling for the carotid pulse. Carotid pulse is a +2 equal bilaterally. I'm listening for bruits. No bruits heard in the carotid. No bruits heard in the thyroid either. All right, so listening for bronchovesicular breath sounds. Take deep breaths in and out. Okay, bronchovesicular breath sounds, no adventitious sounds. Breath sounds are clear. Inspiration is equal to expiration. Okay, now listening for vesicular breath sounds. Breath sounds are clear. There are no adventitious breath sounds. Inspiration is greater than expiration. Okay, good. All right. So, looking at your sternum, I'm just going to peek. So looking at her sternum, I'm able to see the sternum and the apex of the heart. All right, you're going to feel me. I'm going to feel on you. All right, so feeling in the valve areas, there's no heaves or thrills, no pulsations felt in any of the valve areas. I'm able to feel the apical pulse. It's about a +1. When she lays down, I'll feel on the left side with her left laying. All right. So now I'm going to listen for your valve areas. All right. So aortic valve is in the mid-clavicle line, second intercostal space on the right side of the chest. Normal S1, S2 sounds. No bruits. Pulmonic valve is in the mid-clavicle line, second intercostal space on the left side of the chest. Normal S1, S2. No bruits. And near the sternum, in the third intercostal space, is the Erb's point. Normal S1, S2. no bruits. Near the sternum, fifth intercostal space is the tricuspid valve area. Normal S1, S2. No bruits heard. Mid-clavicular line in the fifth intercostal space is her mitral valve area. Normal S1, S2. No bruits heard. Alright, so now I'm going to feel your arms. So feeling her temporal pulses, +2 equal bilaterally. Feeling her brachial pulses, +2 equal bilaterally. Radial pulses, +2 equal bilaterally. Straighten your legs for me. Popliteal pulses, +2 equal bilaterally. Posterior tibialis pulses, +2 equal bilaterally. Dorsal pedis pulses, +2 equal bilaterally. Alright. So I'm going to assess capillary refill on here. So nail beds are pink, capillary refill is less than 3. No tinting of the skin. Skin is warm, palms are pink, hands are dry. Assessing capillary refill over here, less than 3. No tinting of the skin. Skin is warm, palms are pink. Let me see your feet. Assessing capillary refill on the toes, less than 3 seconds on both feet. No swelling, no tinting, and capillary refill is good. So perfusion is good. Alright. So now I'm going to assess your DTRs. You do all this while you're sitting, then we'll lay down. Alright, so assessing her biceps DTR. So DTR is +2 in the biceps. Okay, assessing triceps, +2. Assessing brachioradialis, +2. Assessing biceps over here, +2. Assessing triceps, +2. Assessing brachioradialis, +2. Okay, assessing popliteal, +2 DTR. Assessing popliteal over here, +2 DTR. Assessing Achilles, +2. Assessing this Achilles, +2. All right, so all DTRs are +2. All right. So now I'm gonna have you stand up and we're gonna lay in the bed. Alright. So now I'm gonna have you lay in the bed. Alright. Alright. Put your hands down to the side for me. Alright, can you sit up for me? I'm gonna have you sit up. Assessing JVD. Alright, you can lay back down. Alright, so no JVD noted. JVD is a sign of USC bulging of the jugular veins in the neck. It's a sign of right-sided heart failure, but we don't have any of that. Alright, so now looking at the abdomen. I'm gonna pull your shirt up. Alright, so abdomen is round. There's no peristalsis, no pulsations, no bulges noted. There is no retractions. The umbilicus is midline and inverted. There are no scars. All right. Breathing is easy in the abdomen. All right, so now I'm going to listen to your abdomen. Listen to the right lower quadrant. Hyperactive vowel sounds. Right upper quadrant. Hyperactive vowel sounds. Left upper quadrant. Hyperactive vowel sounds. Left lower quadrant. Hyperactive vowel sounds. Listen to the arteries. Femoral artery, no bruits. Right iliac artery, no bruits. Right renal artery, no bruits. Aorta, no bruits. Left renal artery, no bruits. Left iliac artery, no bruits. Left femoral artery, No bruise. No bruise hurt. Going to tap on your belly, percussing the belly. So percussing the right lower quadrant, tympanies hurt, right upper quadrant, tympanies hurt, left upper quadrant, tympanies hurt, left lower quadrant, tympanies hurt. So the abdomen so far is non-tender, tympanies hurt in the abdominal regions. I'm going to assess for liver span. All right, noting tympany changes to dull about right here. Assessing down. All right, so I'm able to note the liver span. Now I'm going to assess under the mid-axillary line for the spleen. Note the tympany changing from tympany to dull. All right, so spleen is about right there. All right, can you sit up for me one more time? I'm going to assess CVA. All right, so spine is midline. There's no tenderness. Scapula are symmetrical. All right, I'm going to find the 12th rib and tap. Let me know if this hurts. Does it hurt?
No.
Does it hurt?
No.
Okay, you can that. So no pain is found with assessment of flank tenderness. So there's no sign of inflammation of the kidneys. All right, so now I'm going to palpate. So light palpation in the right lower quadrant. Let me know if anything hurts. No tenderness, no masses, no nodules felt in the right upper or lower quadrants or left upper and lower. Deep palpation in the right lower quadrant, in the right upper quadrant, left upper quadrant, left lower quadrant. So no tenderness or inflammation of any of the abdominal organs. All right, so now I'm going to palpate for the liver. Take a deep breath in and out. All right, so I'm able to feel the edge of the liver border. There's no inflammation. All right, palpating the spleen. Take a deep breath. Okay, so the spleen is non-palpable, so no signs of inflammation. Palpating the kidneys with my duck bill. Deep breath in. Okay. All right, now duck bill on this side, on the left side. All right, so no inflammation of the kidneys is noted. All right, so abdomen is non-tender. No inflammation is noted. All right, so now I'm going to have you lift this right leg. I'm testing for my iliopsoas. Lift the right leg. I'm going to push down. Let me know if this hurts in the right side. Any pain?
No.
Okay. Now I'm going to bend your knee. Okay, I'm going to rotate it in. Any pain?
No.
Okay. All right, so I did my iliopsoas and my obturator test. Both of them are negative. If they were positive, there would be pain in her right lower side, indicating inflammation of the appendix. And also, if she had any pain in one of her legs or in her back, I could also test with a straight leg. So if she was having pain in this right leg, I would raise this leg. Keep it up for me. I'm going to press down. Any pain in your back or in your leg?
No.
Okay. So straight leg test is also negative. If there were pain in her back or her leg, that will be a sign of a problem with L5 in her spine, showing that she may have herniated discs, but she doesn't have that, so straight leg test is negative. All right. So now I'm going to have you, can you lift this leg for me? All right, I'm going to push down. Don't let me push down. All right, can you push down on my hand? Good. Now bend this knee. All right, push back on my hand. All right, I'm going to push back. Don't let me. All right, push back on my hand. Good. All right, so good range of motion in this leg right here. Range of motion is a +5 against gravity and resistance. All right, can you raise this leg for me? Push down on my hand. All right, I'm going to push down. Don't let me. Good. Bend this knee. All right, push back. Good. Push down on my hand. Good. All right, you can put this leg down. All right, so range of motion is +5 in this left leg against gravity and resistance. Can you point your toes for me? Can you flex your toes back? All right, can you point your toes down again against my hand? All right, can you flex them back against my hand? Good. So range of motion is +5 in both of her feet against gravity and resistance. Now I'm going to do my plantar test. In both feet, plantar test. Okay, so no fanning of the toes, plantar flexion occurs, so there's no sign of any neurological development. All right, so now I'm going to press down on to test for my Murphy's sign. Any pain?
No.
Okay, so negative Murphy sign. There's no sign of inflammation in the gallbladder. And now I'm going to do my rebound tenderness. Any pain?
No.
Okay, so no rebound tenderness noted, so there's no sign of inflammation in the abdomen as well. All right, so now I'm going to have you sit up again. Sit up again for me to the side of the bed. All right, can you put your arms out for me? Put them up above your head, behind your back. Spread them back out. All right, push down on my hands. Push up on my hands. All right, can you bend your elbows? All right, I'm gonna pull. You don't let me pull. Okay, push against my hands. Good job. Can you put your hands down like this? Can you put them up? Can you fan your hands open? Can you touch each finger with your thumb? Okay, can you make a fist? All right, can you do this? All right, stay like that. So we're testing the Fallon sign. Fallon sign shows any signs of carpal tunnel. If she has any pain or tingling. Do you have any pain or tingling?
No.
All right, so we hold this position for 60 seconds. All right, you can put it down. There's no pain or tingling noted with the Fallon's test. All right, I'm going to palpate. So palpating her shoulders. There's no crepitus, no inflammation. Palpating her elbows and acromion. There's no swelling, no inflammation, no pain. Palpating her wrist joints. No swelling, inflammation, or pain. Palpating her phalanges, joints. No swelling, inflammation, no pain, no warmth in either hand. Oh, good range of motion +5 in her elbows, her arms, her wrists, and her fingers are noted. All right, palpating the median nerve. Does this hurt?
No.
Okay, so palpation of the median nerve does not elicit any pain, so that's a negative Teno sign, so no carpal tunnel is suspected. All right, palpating her hips. No inflammation, no swelling. Hip joints are intact. Palpating her knee, her meniscus. No swelling or pain or inflammation in either meniscus of the knee. Palpating her Achilles. No swelling, pain, or inflammation. Palpating her feet. The joints in her feet, there's no swelling, pain, or inflammation noted. Alright. Alright. So now I'm going to have you go like this. Tap your legs. Alright, so testing for rhythmic motion. Can you go faster? Okay. All right, you can stop. So good coordination is noted with rhythmic motion. No sign of any cerebral dysfunctions or cerebral lesions. All right, so now I'm going to have you stand up. All right, so when you stand up, can you close your eyes for me? All right. Testing Romberg test. So far, there's no swaying. Good coordination. She has steadiness. All right, you can open your eyes. All right, now I want you to do heel to shin on each leg. Heel to shin. All right, so good coordination. Do the other leg. Okay, good coordination. Can you stand on one leg? Can you hop? Okay, good coordination noted. All right, so now I want you to walk heel to toe, just to like the water bottle and back. Well, just to the water bottle, yes.
Heel.
Doing Tatum test. So Tatum test, she has a steady gait. Okay. All right, that's it. All right, step on your tippy toes. Walk that way. All right, so steady gait is noted. Now walk back with your heels. Okay. Steady gait is noted. All right, that's good. All right, can you bend over for me? Touch your toes. Yes, so spine is midline. There's no scoliosis. She has a C curvature. No pain in the spine. All right, you can stand up. All right. All right, doing my wine and rubber test. So rubber test. Feel the vibration? Hear it?
Yes.
Okay, so hearing is intact in both ears. Feel it?
Yes.
Vibration stop?
Yes.
All right, let me know when you don't hear it anymore.
Okay.
Okay. So hearing is good in both ears with ear conduction longer than bone conduction. Stop.
Yes.
Okay, tell me when you don't hear it anymore.
All right.
Okay. So ear conduction is greater than bone conduction in both ears.